Nattokinase is an enzyme present in natto, a traditional fermented Japanese food. It may help dissolve blood clots, which gives it therapeutic potential in heart disease. Natto was found to dissolve artificial fibrin, which is an insoluble protein involved in the formation of blood clots. It has the highest anti-clotting, fibrinolytic activity compared to other enzymes, making it a promising avenue for research in patients with heart disease. Another advantage is that it can either be consumed as a dietary supplement or orally administered. Nattokinase has been extensively studied in Japan, Korea, and China. However, only recently has the enzyme been recognized for its powerful clot-dissolving properties in the Western world. Despite its name, nattokinase is not a kinase enzyme, but instead it belongs to serine protease family of enzymes, which work to break down other proteins. The mechanism of action studied in animals or human cells is as follows. It directly dissolves cross-linked fibrin, which is a protein that forms blood clots. It increases the release of tissue plasminogen activator from cells, which also breaks down fibrin. It increases urokinase levels by converting internal pro-urokinase to urokinase. Increased urokinase activity leads to increased plasmin in the blood. Plasmin is also responsible for degrading fibrin. It inactivates plasminogen activator inhibitor 1. This inhibitor also degrades the fibrin. It inhibits platelet aggregation by blocking thromboxane, which is a substance released from platelets that causes blood clots and blood vessel constriction formation. In 2 clinical trials, one with 79 and the other with 86 subjects with high blood pressure, the group that received the dose of nattokinase once a day for 8 weeks had reduced blood pressure, systolic and diastolic, compared to the placebo group. One of the studies found the reduction in blood pressure was more significant in male subjects. Nattokinase inhibits the angiotensin converting enzyme, which causes narrowing of blood vessels. Inhibiting this enzyme may be involved in reducing blood pressure. Nattokinase has the potential to benefit patients with thrombosis, which is formation of a blood clot inside a blood vessel. In a clinical trial, 45 subjects were divided into 3 groups, and they received nattokinase daily for 2 months. A healthy group, patients considered at risk of heart disease, and patients undergoing dialysis. Risk factors for heart disease, like fibrinogen, factor 7 and factor 8, significantly decreased in all groups. In a study of 12 healthy adult males, a single dose of nattokinase degraded fibrin and decreased levels of coagulation factors, which were involved in blood clotting. Its effect lasted for a long time, over 8 hours, when compared to other enzymes like tissue plasminogen activator urokinase. In rats, its clot-dissolving activity was stronger than that of plasmin or elastase. In rats with thrombosis, nattokinase decreased blood clots better than a saltwater solution. In addition, a high dose of nattokinase was as effective in reducing blood clots as known anti-clotting agents. In rats with a high dose of nattokinase, it fully inhibited thrombus formation. This was similar to the effects of aspirin, which is a well-known blood thinner. Nevertheless, the lack of adverse side effects associated with its consumption suggests that it could be an effective treatment for improving blood flow. Blood clots were experimentally induced in dogs, and oral consumption of nattokinase dissolved the blood clots and restored the normal blood flow in only 5 hours. Nattokinase directly reduces fibrin clots 6 times more effectively than plasmin. It increases the activity of anti-clotting enzymes, and it reduces pro-clotting enzymes. A study comparing nattokinase with statins, which are prescription cholesterol-lowering drugs, randomly divided 82 patients into one of the two treatment groups for 26 weeks. Both treatments reduced total cholesterol, LDL or bad cholesterol, and triglycerides. However, only nattokinase consumption increased HDL or good cholesterol. Other studies do not report a significant reduction in cholesterol levels or only showed a decrease in triglyceride levels. Hence, further studies are required to examine its full effect on cholesterol levels. Daily nattokinase supplementation was remarkably better at reducing plaque size that caused hardening of arteries compared to statin treatment in 82 patients. The mechanism by which it reduces cholesterol levels and decreases plaque size, the result in the prevention of arterial hardening, may be different from each other. High von Willebrand factor, or VWF, is a mediator released by damaged blood vessels that increases the risk of forming clots. These levels are associated with the risk of a stroke. In a study of 79 hypertensive patients, the VWF was reduced by 15% in the group who took nattokinase compared to the placebo group that had no consistent change throughout the 8 weeks. In rats, nattokinase helped to control factors that characterize Alzheimer's disease. Certain factors that are high in Alzheimer's disease decreased with oral nattokinase consumption. Meanwhile, others that are usually low increased with nattokinase treatment, like BDNF and IGF-1, compared to untreated rats with Alzheimer's disease. Thus, nattokinase may be a potential therapy for the treatment of Alzheimer's. In cells, it also degrades amyloid fibrils, which are protein aggregates commonly found in cases of Alzheimer's disease. In cells, nattokinase efficiently degraded parts of gliadin, which is a component of gluten. Hence, it may be a potential new treatment for intolerance to gliadin, known as celiac disease. Nattokinase activity is measured in FU, which is the number of fibrinolytic units. Based on human studies, 2000 FU has produced the greatest cardiovascular and anti-thrombotic benefits. A combination of nattokinase and red yeast rice reduce cholesterol more effectively than nattokinase alone. In a clinical trial, 47 subjects with high cholesterol levels or hyperlipidemia received either nattokinase or only nattokinase and red yeast rice extract or placebo for 6 months. The treatment with nattokinase only started to decrease blood cholesterol and triglyceride levels in the last month of the study. However, the combined therapy of nattokinase and red yeast rice reduced the levels of LDL, total cholesterol, and triglycerides, and increased HDL from the first month onward. Taking nattokinase with red yeast rice can also reduce uric acid, and thus it may be helpful in reducing inflammation, gout, and kidney stones. A byproduct of bacterial Streptomyces amiensis may enhance the effectiveness of nattokinase. In cells, a low concentration serine protease enzyme from the Streptomyces enhance the activity of nattokinase in reducing blood clots. Nattokinase is considered generally safe to consume as a food. This is based on a lack of reported side effects from human clinical trials and the fact that it has been used as part of the Japanese diet for thousands of years. Nattokinase binds to heparin, which is used as an anticoagulant drug. Since nattokinase may cause blood thinning, it should not be paired with other blood-thinning agents such as aspirin or warfarin. This can increase the risk of a brain hemorrhage in patients who have small vessel disease. There's also a risk of clotting mechanical heart valves if nattokinase is substituted for warfarin.